Hi madam, my name is Thurga from Cohort 15. Today, I'll be talking about atopic dermatitis in children. What is atopic dermatitis? Atopic dermatitis is a chronic inflammatory skin condition that leads to dry, scaly patches of skin that are often red, inflamed, and very itchy. The condition may occur at any age, but it typically starts in childhood with changing severity over the years. For the infants lesser than 6 months, there will be red, dry patches of skin on the face. For the infants 6 to 12 months, the patches on the elbows and knees will arise. As the children get older, the area on the inside of knees and elbows are most affected part. Children 2 to 5 years, the patches will arise in the furs of elbows and knees, hand and arms, around mouth and eyes. The patches will become more dry, scaly, and flaky. The risk factor of atopic dermatitis. First, family history. Inheriting Inheriting a flagellant gene mutation from the parents can lead to a leaky skin barrier that reduces the skin's ability to block allergens and also allow the moisturizers to escape. Next, allergies. Allergens like pollens, danders, and dust mites contains enzymes that can break down the skin's barrier. Allergic reactions occur when your immune system overreacts to certain benign substances it sees as harmful. Immune system releases antibodies as well as chemicals that are called to combat these triggers. Histamine is responsible for classic allergic symptoms such as sneezing, itching, runny nose, hives, and skin rash. Next, we have hay fever or asthma. The wheezing, coughing, and chest tightness associated with asthma are often caused by a strong immune response by the environmental triggers. Inflammation causes the airways to swell and narrow, leading to breathing problems. Hay fever is also known as allergic rhinitis. It is not a virus. It is a term that's used to refer to the cold-like symptoms that appear as a result of airborne allergies. Hay fever rashes can be often to be traced to allergens causing a direct contact with the skin. The signs and symptoms of atopic dermatitis is dry scaly skin, itching, thickened skin, patches on the skin, and also small bumps that may become crusty leak if we scratch it. There are types of exomatous disorder in children. First, atopic dermatitis. Atopic dermatitis happens when the skin's barrier is against of irritants and allergens. Next, we have contact dermatitis. Contact dermatitis is a red, itchy patches. Contact dermatitis is a red, itchy rash which is caused by direct contact with a substance. There are two types of contact dermatitis. First, we have allergic contact dermatitis where an immune system reaction to an irritant such as latex or metal. Then we have irritant contact dermatitis. Irritant contact dermatitis happens when a chemical or substance irritates the skin. Then we have exfoliative dermatitis. Exfoliative dermatitis is the skin disorder characterized by peeling and shedding of the skin. We have neurodermatitis. Neurodermatitis, neurodermatitis starts with an itchy patch of the skin which is similar to atopic dermatitis. It can cause thick, scaly patches to pop up on the skin. Next, we have Dashirotic Eczema. Um, Dashirotic eczema is usually caused by small blisters to form on your hands or feet. The blisters are always itchy and usually filled with fluids. Next, we have seborrheic dermatitis. Seborrheic dermatitis is a chronic inflammatory disorder of skin which involves scalps, eyebrow, eyelids, and ear canal. It is always found on oily area of the body such as face, upper chest, or back of the body. Then we have nummular eczema. Nummular eczema causes round cone-shaped coins to form on the skin. It is also can be triggered by a reaction to a skin injury such as a burn, abrasion, or insect bites. The reason why I choose atopic dermatitis because it is a common dermatitis that can occur in children during uh, baby time until they grow. It is a long-lasting chronic inflammation. It is a long-lasting skin condition as well. If we never treat it in a correct way, there is chances where the children can have this uh, dermatitis in their future life as well. Recommendation treatment for atopic dermatitis in children. First, we have moisturizers. Moisturizers lock in water and create a barrier against things that can irritate our skin. It is also helps to prevent itching and cracking skin. Next, we have antihistamine. Antihistamine is a type of allergy medicine and it blocks the effects of a substance in the blood which is called as histamine. It is also help to relieve the itching and it will cause us to drowsiness. We also have topical steroid agents. Topical steroid agents reduce inflammation and itching. It also blocks chemical reactions that causes inflammation. Steroid also can change how our immune cells I'm sorry. Topical steroid agents also works by changing our immune cell works. Immune cell release toxins into the body which is add to the inflammation. Steroids work by tempering this action and preventing tissue damage that excessive inflammation can cause. We also have wet wrap therapy. The wrap can help us to cool and rehydrate your skin, helps with itching, soothes inflammation, and help topical medications to work better. It is, it is usually worked by the fabric wraps are always soaked in water and also applied to the affected skin on the body. Counseling for the patient. Take a shorter bites. Parents should bath their children using a lukewarm water rather than using a hot water. Then stay away from triggers. Children should avoid foods that can bring allergic reaction to them, such as egg, milk, soy, and wheat. Also, stay away from triggers like soap, detergents, dust, stuffed toys, and pets. Parents also recommended to wear their children using the soft clothes. Avoid harsh itching clothes like wool and also non-breathable fabrics such as polyester. Children should always have short fingernails to prevent the damage uh, of the skin from scratching. And also drink plenty of water to make sure your kids' skin is always moisturized and it is not dry. So, guide on using product. Topical steroid. Apply the medicine when your child's skin is still damp after lightly drying with a towel. Remember, do not rub your children's skin. Apply a amount of medicine at the affected area 2 times a day as needed. Moisturizers. After applying the topical steroid, apply the moisturizer within 3 minutes or the skin will become more drier. Antihistamine. It is helpful for the parents to give their children antihistamine before bedtime because antihistamine can make the children to sleep. Wet wrap therapy. The fabric wraps are soaked in the warm water and apply the affected area. So, the way of using wet wrap therapy is first, moisten the dressing in water until it is slightly damp. Okay, then wrap the moist dressing on the affected area on the children's skin. After wrapping the moist dressing, wrap a dry dressing on the wet one and also carefully put on nighttime clothing as to not disturb the bandages or the dressings and leave it for several hours or overnight. That's all from me, madam. I'm sorry if there is any mistaken during this video, and also I'm sorry again. Thank you for watching my video. I would like to apologize if there's any mistake in this video, and also thank you for spending your time to watch my video. Thank you.